Laban movement analysis, or LMA, is a respected framework for observing movement in dance and movement therapy. Developed by Rudolf von Laban, a pioneering movement theorist, LMA emphasizes that movement reflects a person's inner life, including emotions, intentions, and thought patterns. In DMT, LMA is not about judging dance skills. It's a professional system for understanding how the body communicates beyond words. For instance, someone may verbally express confidence, yet their body language may tell a different story. Collapsed posture, minimal movements, shallow breath, and withdrawn eye contact. LMA provides therapists with a structured language to observe these patterns. The framework is organized into four major domains known as BESS: body, effort, shape, and space. The body domain focuses on what is moving. It examines which body parts initiate movement, whether movement is integrated or fragmented, and how breathing functions. These observations are clinically significant as they often reflect neurological integration, emotional holding, or habitual behavioral styles. For example, if someone only moves their hands while keeping their torso rigid, it may indicate emotional guarding or a patterned response. In therapy, these observations lead to exploration rather than fixed conclusions. LMA is invaluable because it helps therapists uncover the body's hidden stories in a systematic, evidence informed manner, moving beyond mere intuition. The most renowned aspect of Laban movement analysis, or LMA, is effort, which examines how movement occurs, the energetic quality or dynamic attitude behind actions. Effort consists of four key factors: weight, time, space, and flow. Weight pertains to the relationship with force, distinguishing between strong and light movements. Strong movements often convey determination, assertion, anger, confidence, or groundedness, while light movements may suggest delicacy, hesitation, gentleness, or a lack of commitment. Time indicates urgency, differentiating between sudden and sustained movements. Sudden movers may appear decisive, reactive, anxious, or energetic, whereas sustained movers often seem calm, thoughtful, slow, depressed, or highly controlled. Space refers to attentional focus, contrasting direct attention, which is focused and singular, with indirect attention, which is scanning and flexible. Flow relates to movement control, distinguishing between bound movements that are contained and controlled and free movements that are fluid and uninhibited. These qualities are not inherently positive or negative. Context plays a crucial role. Laban also identified combinations of these qualities as basic effort actions, including punch, glide, float, slash, dab, ring, flick, and press, which help to identify movement behavior patterns. Next is shape, which investigates how the body alters form in relation to itself and its environment, growing upward, shrinking inward, spreading outward, sinking downward, enclosing, reaching, retreating, or moving in self soothing patterns like rocking. Shape can reveal relational tendencies, emotional states, or defensive patterns. For instance, a person who frequently folds inward may indicate withdrawal, shame, fatigue, or a need for protection, while someone who consistently expands outward may display confidence, a desire for connection, or compensation. Understanding shape aids therapists in comprehending how a person emotionally exists within physical space. The final major domain is space, which explores where movement occurs. This includes personal space, direction, pathways, levels, planes, and spatial preferences. Some individuals avoid the floor, while others may never move backward. Some occupy minimal space, and others dominate the room. Each of these patterns can provide valuable therapeutic insights. Laban viewed movement through a geometric and architectural lens, almost as if it were living design. In dance movement therapy, Laban movement analysis is utilized for assessment, intervention planning, rapport building, progress observation, trauma work, developmental work, and understanding group processes. Therapists may employ LMA informed mirroring, matching the quality of a client's movement to foster attunement and nonverbal empathy. For instance, a highly anxious client with restricted movement may first need the therapist to connect with that contained state before gently introducing freer movement for regulation. LMA is particularly beneficial in trauma informed therapy, as trauma often manifests in movement such as restricted breath, frozen posture, fragmented sequencing, hypervigilant scanning, or difficulty transferring weight confidently. It is also applied in child development, autism support, psychiatric care, rehabilitation, elder care, schools, performance training, physiotherapy, and somatic practices. However, LMA has its limitations. It requires proper training, cultural sensitivity, and caution. A single movement does not equate to a diagnosis. Factors like pain, disability, medication, personality, social conditioning, or cultural norms can all influence movement patterns. When used wisely, LMA serves as an extraordinary bridge between body language, psychology, neuroscience, emotional regulation, and therapeutic transformation, providing therapists with a professional grammar for understanding the silent language of human movement. Keywords: Laban Movement Analysis, or LMA, is a professional system for observing movement widely utilized in dance and movement therapy. Created by Rudolf von Laban, it emphasizes that human movement reflects our emotions, thoughts, and relationships. In dance and movement therapy, LMA focuses on understanding what the body communicates beyond words. It allows therapists to observe movement scientifically rather than relying on emotional interpretations. LMA is structured around four key areas known as BESS: body, effort, shape, and space. Body involves observing which parts are moving, the quality of breathing, and how well the body coordinates. This can reveal emotional patterns, trauma responses, or habits. Effort examines how movement occurs, focusing on energy and quality through four factors: weight, time, space, and flow. These elements create movement patterns like punch, glide, and float, helping therapists understand individual movement styles. Shape looks at how the body changes form, reflecting emotions and psychological states through movements like expanding or folding. Space considers where movement occurs, including personal space, direction, and comfort in the environment. In therapy, LMA aids in assessment, rapport building, and emotional understanding. Therapists use LMA based mirroring to connect with clients non verbally, supporting emotional regulation. It is beneficial in various fields, including trauma work, child development, and rehabilitation. However, LMA should be used carefully as it is not a diagnostic tool. Movement is influenced by many factors, including culture and context. In essence, LMA serves as a professional language for interpreting the body's silent communication in a therapeutic context.